Neonatal hypoglycemia refers to a random blood glucose level below 2.6 millimole per liter in the neonate, that's the newborn. And as the clinical signs may be variable or even indeed absent for small or sick babies or infants of diabetic mothers, the random blood glucose level should be checked every 3 hours for the first 24 hours until it stays above 3.5 millimole per liter for a further 24 hours. Neonatal hypoglycemia may result in death if not promptly treated and should therefore be managed as soon as suspected. Successful treatment results in prompt response, and to prevent hypoglycemia, breastfeeding should be encouraged soon after birth. And if the neonate is unable to suck, his gastric tube may be passed and expressed breast milk. The expressed breast milk should be given. And if enteral feeds are contraindicated, intravenous fluids should be started immediately. Causes are prematurity, intrauterine growth retardation, baby born to a diabetic mother, infection, asphyxia. Okay, symptoms are irritability and restlessness, tremors, sweating, seizures, lethargy, and the signs that are usually elicited are sweating, tremor, tachycardia, seizures, unconsciousness. Investigations include a random blood glucose using bedside glucometer. You check within 2 hours after birth and at regular 3-hourly interval in infants at risk. Other investigations depend on the suspected underlying cause. So the treatment objectives are to maintain blood glucose levels within normal limits and to identify and treat underlying cause of hypoglycemia and to prevent complications, for example, brain damage. Non-pharmacological treatment. The blood glucose monitoring have to 12 hourly, 30 minutes to 12 hourly in hypoglycemic infants until the normal levels are attained. For pharmacological treatment, initial management, give dextrose 10% IV, 4 milliliters per kilogram as a bolus. Maintenance treatment following immediately after the initial management, give saline 0.18% in dextrose 10% and 60 to 150 milliliters per kilogram per day depending on the age of the newborn. So maintenance fluid requirement for day 1 in premature, you give 60 milliliters per kilogram per day. Day 2, you give 90, that's in the premature, 90 milliliters per kilogram per day. Day 3, 110 milliliters per kilogram per day. Day 4, 130 milliliters per kilogram per day. And more than day 5 or 5 days, you give 150 milliliters per kilogram per day. And also for 10, day 1, you give 50 milliliters per kilogram per day. Day 2, give 70 milliliters per kilogram per day. Day 3, 90 milliliters per kilogram per day. And day 4, 120 milliliters per kilogram per day. And also more than day 5, you give the same 120 milliliters per kilogram per day as in 10. Additional management, it depends on the underlying cause. Referral criteria, so refer to a specialist if patient does not respond promptly in spite of adequate treatment.